Okay, we are officially recording, so we'll go ahead and get started. What I'm going to be focusing on today is just basically actually, hold on, let me try to move that on my screen. Is basically just the narrative portion of the CP2 assignment, okay? Because that's the part that's due this evening, okay? In tomorrow's session at 2 o'clock, that's when I'll cover some additional specifics related to the pathophys statement and the nursing care plan. But I really wanted to kind of focus today, this session, on the narrative because that's the piece that's due first. So if you're prioritizing getting your stuff done, that's where our focus is going to be. So you are completing the narrative portion of CP2 on the patient that was in the ATI real life clinical reasoning scenario, the COPD one, Mr. Hector Gomez. All right, so in focusing on the narrative assessment, what you're going to end up doing is handwriting your narrative assessment. You're going to use the standard template that's on the clinical Play-Doh, okay? When you handwrite this out, once you have it written, you're going to take a picture of it just the way you do for your class prep, or scan it however you want to do it, but it needs to get uploaded to the Med-Surg Nursing Care Plan Portfolio Assignment Dropbox. Okay, and that needs to happen tonight by 23:59, Thursday, April 9th by 23:59. Okay, so that is a different Dropbox than your general weekly Dropbox that you do the regular assignment template and your journal. So I just want to be very clear on that, okay? For the narrative, your narrative is going to be based on the findings from the first video interaction of Nurse Allison and Mr. Gomez. So the very first video that it shows you shows Nurse Allison receiving the ER report. The next video is where she's seeing Mr. Gomez for the very first time. So you want to take your narrative findings from there. Now, there's some things that are updated. If you look at the ER report, obviously in that first video interaction, she updates some of the vital signs. There's some changes in perhaps his level of consciousness and orientation. How does he actually appear with his respirations? In relation to the depth of them, the regularity, positioning, that sort of thing. So you want to incorporate the information from that first video interaction. Now, there's obviously, it doesn't cover everything. So if there's not updated information on a specific area of the narrative in that first video, you pull information from the ER report. For example, she does not repeat his temperature. So you can use the temperature and the blood pressure from that ER report, okay? In the assignment template directions, the alternate clinical experience template directions, there is a paragraph that contains additional assessment data. You want to make sure you include that because that hits the other body systems that you're going to need to include in your narrative. Okay, so this is just the screenshot of the very first part of that first interaction of Nurse Allison and Mr. Gomez. Okay, so this is the video that you're looking for. It's the very first time she's meeting him. He's sitting in the bed. So take note to his position. Take note to, when you're watching the video, his respiratory effort. Take note to the equipment around the room related to his oxygen. How much oxygen is he on? Does it have humidification? Does it not? Those different types of things. Also, he's wearing glasses. So those little things. Where is his IV access? Okay, if you can get in a little bit close, what does it look like? What type of access is it? So you want to base your main narrative findings off of this, and then use the ER report and the additional paragraph for the rest of the findings. This will make a little bit more sense as I move to the next slide. Okay, this is the actual transcript of the telephone report from the ER nurse, Cindy, to Nurse Allison. Okay, so as you're doing this scenario, and you might have to go back into the scenario and, you know, watch just that part of the video, the second video, then, you know, a couple times just to make sure. But this is the transcript of the telephone report from the ER nurse. So I just wanted to provide that to you, and you can actually see that on the ATI scenario. After you watch the video, or actually it's right underneath the video, there's a button you can click on that says transcript, and this is what it will show you. I just simply took a screenshot of that. This is also the additional assessment data that was provided in the alternate experience clinical template. Okay, so this information is stuff that you will use in your narrative. It supplements the other body systems to make sure that you're covering that. Now, as you're doing your narrative assessment, remember the resources that you have, okay? You have that narrative assessment guidelines documentation handout. That is also posted on the clinical Play-Doh underneath CP2 in student resources. So make sure you're referring to that, particularly for terminology, for abbreviations, and just also for general flow. You also want to incorporate any feedback that you've received from your clinical faculty, okay? If they've been noting some different things on there, hey, you forgot edema, or you didn't put the pupils in there, or maybe they're correcting some abbreviations in there, you want to make sure you're incorporating that, find those feedback. What I would recommend that you do prior to uploading your final copy that's going to be graded, I would look at your final copy in one hand, and I would pull up the grading rubric in the other hand, because that is exactly how it's going to be evaluated. Okay, so look at your narrative in relation to the grading rubric, that narrative section. Have you included everything? Are things accurate? Are you using appropriate abbreviations, terminology? Are you not using excessive words? Remember, you don't need to say the patient, you don't need to say client, that's understood. I know I always harp on you about proper grammar and spelling. Here you do need proper spelling, but this is the one area where we're not writing incomplete sentences. You're using a lot of commas, you're using a lot of semicolons, abbreviations. So that's very important. Now, with abbreviations, they do have to be accepted general medical abbreviations. Please don't just make stuff up. Refer to the resources that are in that documentation handout, as well as in the on the class Play-Doh under supplemental instruction. I believe there was some stuff there on narratives as well that can help you with those abbreviations. But don't just make something up. If it's not legit, it's going to count as one of those errors when I'm looking at the grading rubric. Okay.
I have a quick question, Mrs. Klein.
Sure. Let me pop back on. Okay, go ahead. You can ask.
Okay. I know it says, so you provided Mr. Gomez's voiding in the urinal and then the amount, the color, and the clarity. Are we supposed to use that or the transcript that they gave us describing the urine, the amount, and the clarity?
I fixed it on the slide here. The original thing was 275. Honestly, if you're off a little bit on that, I'm not going to split hairs on that, because it's listed two different ways. You do need to make sure you're including that information though in the GU.
Okay, and then for the last BM was 2 days ago. Are we just supposed to make up a date? Do you want us to just put XX/XX? Like, what do you want us to do for that?
Okay, so that's a really great question. So what I'm going to tell you to do is, when you go back into the scenario, up at the top right-hand corner, you can actually open up the electronic medical record, the EMR. And all of his documentation is on a specific date, okay? So the day he was admitted, that's the day that you're doing your assessment. That's the day that you should figure on 2 days ago.
Okay, thank you.
Completely give it away. But when you're starting with your narrative assessment too, remember, you have to start with the date and time that you're assessing him. So make sure you look at those records for the date that he was actually admitted.
Okay, thank you.
He's getting to the floor about noon. That's when Nurse Allison's seeing him for the first time. but do take a look at the date, because that's important. If you're writing out the narrative assessment, we have to be able to track it back to a date. The other thing, there's a couple things that I want to mention in here. When you're looking at that narrative assessment guidelines document, that handout to kind of help you, there's going to be some things on there that just simply were not specified in this scenario. For example, you're not going to know the route of the temperature, okay? You do not know how they took the blood pressure, whether it was an auto or manual, and what limb they used, okay? If you don't have that information, you can't include it. Don't make it up. Just kind of omit that and keep moving on, okay? In real life, if I was doing this on a real life patient and I took the blood pressure, I would be documenting it's a manual blood pressure. I took it in the right upper arm, RUA, okay? But there's some information there that's, it's just not there, okay? It's just simply not there. For example, muscle strength isn't there, although, yeah, there's not a rating for muscle strength, but keep in mind what the patient says during that interaction. How does he look during that video interaction? Is there a conclusion you can draw from that? Not necessarily putting a number on it, but can you come to a generalized consensus on that? Okay.
Can I just ask some questions quick too, Mrs. Klein?
Sure, that's what we're here for.
In your description that you gave, you also said the pulses were palpable. So would we give that like the rating, like the +1, +2?
Okay, great question. So look at what it says. Easily palpable radial and dorsalis pedis pulses, okay? So you're rating that is easily palpable. Would that be equivalent to a +1?
I mean, I wrote +2.
Then you are right on there, because if it was +4, what would it say?
That would be rebounding, right?
Well, bounding.
Bounding, yeah.
Bounding. Okay, so yeah, so you're able to, you can do that. You can,
okay.
If it's easily palpable, it's not weak, it's not bounding, so what is it going to be?
Okay, and
Okay.
then
Good question.
one more or two more quick questions. For integrity, in our little cheat sheet that you gave us, it says about like mucous membranes and everything. Since that's not listed anywhere, do we just not use that as well?
Yeah, you can just omit that. Unfortunately, the video does not get close enough to his mucous membranes that you could actually make a good assessment. So you can omit mucous membranes.
Okay. And what about tenting as well?
Yeah, there's no tenting there. So there's no edema, no tenting.
Okay, awesome. Thank you so much.
Good questions. Who else has questions? Feel free to turn your mic on and ask the questions. I do have the chat box up too, but I don't see anything in the chat. So other questions at all? Really use your resources, okay? That's the biggest thing that I can say. So go ahead and, you know, just pull out, hopefully you've gone through this and you have at least a basic draft. Take your draft as a starting point and make sure you have everything incorporated in that, and then look at that documentation handout. Let that help you. Let your previous clinical faculty feedback help you with this, okay? And then look at it with the rubric. That is the biggest piece of advice that I can give to anyone. Literally look at your assignment and look at the corresponding rubric, because that's how it gets evaluated. You know, I'm literally going down there. Is it accurate? I mean, if you mark something that, you know, his capillary refill is delayed, that's obviously incorrect based on the information that you have.
Mrs. Klein, I have a question.
Yep. So just hold on 1 minute. So just go through and make sure that you're looking at that rubric. Okay, go ahead. Who's ever asking the question?
It's Laura.
Okay.
With in the initial, right at the top of the narrative, when you put the pertinent history,
Yes.
is there anything to put in there anywhere?
So, okay, so let's think this through. He was admitted today for what? What was his actual, based on the ER report, what did they say? Let me go back to that little transcript.
Exacerbation.
Okay, so if he has an exacerbation of his COPD, what do you think's in his past medical history?
Okay, so just COPD then.
Yeah, no, there's nothing else specified in the scenario, but it's an exacerbation, so he definitely has a past medical history of his COPD. And something to kind of think about too, when you talk about narratives in general for past medical history, you're not listing every single thing. You look at what we call pertinent past medical history. What are things that are impacting the patient right now, or things that are going to influence the care that you're going to give to the patient? So of course, obviously, you know, their admitting diagnosis is up in why they're admitted. If they have a history of respiratory problems, that's pretty important. If they have a history of, you know, hypertension or diabetes, heart failure, those things are always major diagnoses that should be included in that past medical history. You know, I have a history of migraines as a teenager. You know, at my age right now, if it's, unless I'm in with a neuro problem, that's not really a pertinent thing that needs to be in my medical history. Same thing with surgery. You know, if they had their appendix out when they were 8 years old, but they're here today for a COPD exacerbation, that appendix doesn't really impact what's going on. Now, if your patient was in for a GI issue, or they're post-operative for abdominal surgery, that past medical history or past surgical history of an appendectomy would be appropriate to include. So just a little caveat with that. Okay, so a couple questions here. Both the ER report and Allison state lung sounds, but the ER report is more detailed in the type of location. Allison's is more recent. Which should we use? I'm actually okay if you use either or. I actually made myself a narrative key, and I had both of them. I basically did one with that and one with what Allison said. I'm okay. Again, you're doing this on a simulation patient. This would be ideal to do on a real life patient. So I'm going to have some, you know, I have some leniency with this. Okay. I'm basically looking for accuracy. So if it's accurate with the ER report, okay. Allison's is not as detailed. I know I was watching that. I'm like, well, where are the crackles? Because I would put where they're at. And she didn't say that in the scenario. So I am looking at this, you know, with some leniency. I know even with the vital signs that were updated with Allison, there's some differences. But the differences in the vital signs that Allison got are very important in this scenario, because it leads you to the question of, you know, what's her next action? So without giving it away, those things are very important. But getting back to the narrative, I will look at it both ways, okay? I'm not looking at marking something as inaccurate unless it's like completely inaccurate, okay? So hopefully that would be better. Grace, next question, is denies pain or negative pain, circled negative sign, more appropriate? In real life, I would use denies pain, because when you document denies pain, that indicates that you have actively asked the patient if they are experiencing pain. Okay, so that's very different than if I just hit no complaints of pain. Okay, well, the patient didn't complain of pain, but maybe they're very stoic and they don't want to say something. But if I actively ask, they'll report that pain. So when you say denies pain, it just makes things more clear, and it just shows that you actively assess that. Okay, would we want to include the increased alcohol use under the history? You could definitely include that under the history. What you could do with that would be, it was a questionable history of alcohol abuse, so you can put that under past medical history, and you can put possible ETOH abuse. Okay, for the blood pressure, yes, later on in the video, when she does the blood pressure, yeah, if it's non-invasive blood pressure, right arm, you can throw that in there, that's fine. I was going off the basic ER one, and it just wasn't specified. So again, I'm going to be fairly lenient with this. If you're missing like key important details that were really in there, like, you know, you didn't put the O2 sat, didn't put how many liters the patient's on, that sort of thing, that I would consider a true error. Otherwise, do know that I'm looking at this with some leniency. Okay, so I don't want you getting, you know, totally freaked out about that. Shouldn't we put his allergies in the pertinent history? You definitely could do that. I will tell you, typically with a narrative, we generally don't. The purpose of a narrative is essentially to create a snapshot or a picture of what your patient looks like at this period in time. Okay, so it's not necessarily going over, you know, what brought them into the hospital, how he was found unresponsive on the floor and whatnot. It's basically you are painting a picture of what your patient looks like right now. So, I mean, you could put allergies up in there. I will tell you, generally, when we were doing narratives, the allergies was not there because it was another place on the chart. And that's usually prominently marked on the chart. But it wouldn't be wrong to put it in there. It's not like I'm going to ding it and be like, no, you don't need to have that. From a time management perspective, it's not necessary to be in there. And right now we have you guys do narratives, you know, one, because it helps you think like a nurse. It helps you learn to talk like a nurse, because when we're giving verbal report at the bedside to the oncoming nurse, we speak this way. You know, if I'm talking about, you know, this patient, well, they were admitted with pneumonia 2 days ago, respiratory assessment, their, you know, respirations are 24 a minute, they're pretty deep. Mild shortness of breath at air, very short of breath with exertion, lung sounds are, it's just the way we speak. And that's actually why we have you do these narratives. And I know students don't like them. It's much easier to chart in an EHR, okay? It's much easier to chart in Epic, where you have, you know, terms and words that you can pick from and click. But there are times that Epic goes down. And then again, like I said, when you are giving that report to that oncoming nurse at the bedside, or when you're talking to the provider in person, you're talking to the provider on the telephone, being able to, you know, group those assessment findings together and speak intelligently is going to be a critical communication skill for the RN. So that's why we make you do these. It's not that I actually love to grade these things. I really don't. But it is an important skill that you need to have as an RN. So there actually is a purpose behind it. Okay, other questions at all, either in the chat box or verbally?
I have a couple questions. Okay. I had a question about the IV assessment. Okay. So she doesn't assess the IV, and then there isn't anything, like there's no solution or anything running to it until later. So do you want us to take just that beginning piece for the IV, or?
Yes, just use the beginning piece for the IV. So what do you know about the IV? Okay, I know the location and I know the type of IV. I know it's a saline lock. That's pretty much all that I know. I can kind of look in the video at the insertion site, and it does not look puffy. It doesn't look like there's bleeding. So you can speak to the site condition, but yet
right.
Hooked up to it, so you wouldn't have, you know, any type of fluid infusing at any type of rate.
Okay.
Okay.
And then my other question is, I know it's a physical assessment, but would his recent spousal loss be something we would want to note? Because I mean, that's pretty significant, but it's not a physical symptom.
Okay, so great question. So it's not something that you would necessarily note in the physical assessment. I mean, unless he was showing visible signs of depression, that you could speak to his mood and that up in the narrative. But the other piece you want to kind of look at is where that really comes into play, is when you get to the care plan section of CP2 and you're talking about psychosocial factors. So yes, that would definitely be incorporated there. Not so much the physical assessment, because again, we're focusing on their condition at the time. Okay, so for musculoskeletal, you said we could use what the patient says. So when documenting it, do we put, for example, patient states, I feel weak, or do we interpret that as strength 2 or 3? You cannot interpret that as strength 2 or 3, because for you to truly tell strength 2 or 3 or 4 or 5, you need to actually see the movement. He does say he feels weak. So you can say, you know, states, I feel weak, and you can put I feel weak in quotations. Okay. Are we supposed to assume that he's continent since she voided in the urinal? Yes. So that's the definition of continent, that they're able to control their bladder or control their bowels. So whether they're urinating in the toilet or they're using a urinal or a bedside commode, that is considered continent. They would be incontinent if they leak in a brief and don't know that they're going. Also, not that it applies to this particular situation, but just as a general comment, if your patient has a Foley catheter, an indwelling catheter, you cannot say continent or incontinent. Okay, that's just not an option there. What you would say is, you know, 16 French or whatever size French indwelling catheter, secured to right leg, draining clear yellow urine, or, you know, whatever the urine looks like. Okay, but if they're voiding, it's either going to be continent or incontinent. Okay, other questions, either chat box or verbal?
Mrs. Klein,
Yes.
this is kind of related more to the patho.
Okay.
But like on the top it says COP exacerbation.
Yes.
The thing, like, there's not as much information on exacerbation as COPD. Is it okay that I you know, basically put the COPD and then emphasize like the exacerbation also?
Yes, that's perfect. That works.
Okay.
That works. Kind of getting a little ahead. I'm gonna, since you're going to be likely going back into the scenario and looking at for some additional details for your narrative, I am gonna pop ahead real quick. I'm not gonna completely go into the pathophys, but I do want to point out one thing because I think it will help save you time. You can always go back into the scenario and watch different pieces again. The pathophys statement that you're gonna do as part of CP2, the majority of it you probably already have done because you did it for the alternate clinical assignment template, okay? What is different, the added piece for CP2, and I'm gonna go to the next slide, this is just a screenshot of that template. You'll see in each section, it has an area that says relate to the client. So up there, relate etiology risk factors to the client. So for example, what risk factors did this client have for COPD and for COPD exacerbation? Okay, for client signs and symptoms, what specific symptoms did Mr. Gomez exhibit, both in the ER report and when we're looking at the patient? For client specific lab and diagnostic tests, you're going to need to look at the scenario because in that EHR, or in the I think they call it EMR, electronic medical record, there are diagnostic tests. There are lab results in there. There is a chest x-ray result in there. When you get into client-specific treatment, again, open up that EMR. There actually is an MAR in there. There are orders and progress notes in there. So you can get that information that's client-specific. And then for the teaching statement, for the client treatment, you should probably modify that a little bit so that fits more appropriate for what Mr. Gomez, how Mr. Gomez was being treated, okay? We'll hit a little bit more and talk through this on the patho and the nursing care plan with tomorrow's session. Like I said, today I really wanted to focus mostly on the narrative, but I did want to show you this because as you're in there, if you're watching the video pieces at the beginning for that narrative assessment stuff, you can probably pick up a lot of this information as well. So that's why I wanted to mention that. Okay, other questions, either on the chat or verbally? Okay, I don't have a printer available. I may have an extra narrative, but I'm not sure is a handmade. Yes, if you, ideally, I would prefer the template if you can print it. If you can't, don't sweat about it. You will need to just write it on a piece of notebook paper. It should be lined paper, and you just need to make sure you're labeling all of your different areas. So at the top, you know, your patient intro, your vitals, neuro, cardiovascular, respiratory, and so on and so forth. So ideally, if you have the print copy, that would be the easiest. If not, you do what you do. I'm working with you. You know, this obviously isn't how we intended this original assignment to be done, but I want to make sure you get the most out of it, because the narrative piece of this, when you think about how this relates to your, essentially your summative clinical evaluation, okay, this obviously relates to physical assessment. You know, are you able to get the correct information? And it relates directly to communication. Are you able to document the information accurately? Are you using appropriate abbreviations and terminology? So this relates directly to, I want to say it's COM number 1 and COM number 2. And also, I believe it's nursing process number 1. Not having the weekly eval in front of me, those are the ones off the top of my head. When you think about your pathophys statement, that relates directly to nursing process in the sense that, you know, we're talking about assessment and diagnostics and treatment. It also relates to evidence-based practice. Are you supporting your information with appropriate resources? Are you citing them appropriately? Is it thorough? Did you include the information that needs to be there? So, you know, your pathophys statement hits a lot both in nursing process and the evidence-based practice behaviors under there. Obviously, the nursing care plan itself, that's going to hit consumer-centered care because you have to incorporate those psychosocial factors in that section. It obviously incorporates nursing process because you are identifying the client's priority physiological problem. You're supporting it with assessment data. You're formulating a goal. You're developing interventions. You're individualizing those interventions to your patient. And we'll talk a little bit more about how you do that tomorrow. Just a hint, that EMR gives you a lot of information. The rationale, those evidence-based rationale, faculty level rationale, relate directly to evidence-based practice. And if you look at the grading rubric, you want to have one of your interventions focus on patient teaching. So something related to COPD exacerbation, teaching that patient. So that then relates back to teaching and learning on your weekly eval. From an informatics perspective, the fact that you're accessing ATI, you're navigating the EMR inside this scenario, that addresses informatics. So this assignment really hits pretty much everything in your weekly evaluation. And that's why we use this kind of as a culminating assignment that shows that you have met the clinical behaviors associated with this course. So that's why this assignment is weighted so heavily. And that's actually why I grade this assignment, that it's not graded by the clinical faculty. I grade this for all students. Because I want to make sure everybody's on that level playing field, everybody's being held to the same standard. So other questions at all? Because that's pretty much all I have. Again, we'll hit more on the patho and the nursing care plan tomorrow. I really wanted to focus on the narrative because that's the piece that you're prioritizing right now.
I have a quick question, Mrs. Klein.
Sure.
So for the ER transcript that we got, I was alert and oriented, but the first interaction that he had with Allison, he knew his name and date of birth, but and then he said the hospital, but he didn't know what hospital. So does that count as alert and oriented times 1 because he knew his name, or times 2? Because he knew he was in the hospital, but he didn't know
I would say times 1, and actually I documented as times 1. So that's the other thing too. When we say alert and oriented times 3, we know what 3 we're talking about. If you say alert and oriented times 1, well, is it person? Is it place? Is it, you know, we don't know what it is. So I would say, you know, oriented to person only.
Okay.
I mean, he knew he was in the hospital, but he didn't know what hospital. He had no idea, you know, time-wise. And he was very tired. He was very fatigued. I mean, you could just see he was just absolutely exhausted. And for those of you that have completed and went through the entire scenario and got your satisfactory level already, there's a reason he is more tired. And that kind of leads into the next question that was on the scenario. So I don't want to give it away in case there's somebody who hasn't completely worked through it yet. But something's happening acutely that's making him more tired. And I'll leave it at that. Other questions at all? Okay. Last call. Any questions? Any questions? Okay. All right. So we will end this here. I am going to end the recording, but I will get this uploaded to the class YouTube channel if you want to refer back to it. I will also post this part of my screen area that we covered. Actually, I'm just going to post the whole thing that I'm going to have for tomorrow too, but we're still going to get on tomorrow at 2 o'clock to cover the rest of it, just to go over the patho a little bit more and to go over the care plan piece. So I will see you in the Zoom class tomorrow, and then the extra Zoom session for CP2. Where can I find the class YouTube channel? If you go back on the class Play-Doh on the news items, you probably have to scroll down because it's probably about 10 items down now. There is the link to the class YouTube channel. I'll try to move that up in the news feed just to make sure everybody can find it. You can actually subscribe to the channel, but that gives you a notification of anytime something is uploaded. I'm sorry to whoever the poor soul was that was subscribed the other day, because when we were having problems with the capture videos and Capture Central, I found a backdoor channel. So I downloaded all of those MP4 files and then I re-uploaded them onto the YouTube channel. So whoever was subscribed that day, and I know there was at least one of you, probably got about 56 notifications. I apologize. That will not be happening moving forward. You would only get a notification each time a session is uploaded. So things related to CP or the class sessions or the exam, prep sessions. So, all right, everybody, enjoy the rest of your day. I will see you in the Zoom classes tomorrow. Okay, and have a great day.